What is a urine cytology test for bladder health? Imagine a simple urine sample holding the key to uncovering important clues about your bladder health. A urine cytology test is a laboratory exam that looks at cells in your urine to find signs of problems in your urinary tract, especially the bladder. It's mainly used to check for bladder cancer by spotting abnormal or cancerous cells that have shed from the lining of the bladder or other parts of the urinary system. When cells become cancerous, they often change in size, shape, or appearance, and a trained pathologist can see these changes under a microscope. The process starts with collecting a urine sample, usually during a routine visit or as part of ongoing monitoring. The sample is then sent to a lab where a specialist examines it carefully. They look for cells that are irregular, enlarged, or have unusual features that might suggest cancer or precancerous conditions. The test is especially good at detecting high-grade bladder cancers, which tend to be more aggressive. However, it is less sensitive for low-grade tumors, meaning it might miss some less obvious cases. Besides cancer, urine cytology can also reveal signs of inflammation or infection in the urinary tract, which can be helpful in understanding bladder health more broadly. Clinicians often use urine cytology in several ways. If someone shows symptoms like blood in the urine, painful urination, or frequent urges to urinate, this test can help determine if bladder cancer might be involved. It is also used to monitor patients who have already been treated for bladder cancer, helping to catch any recurrence early. When combined with other procedures like cystoscopy, where a doctor visually inspects the bladder with a small camera, urine cytology adds an extra layer of information. Sometimes, it can even assist in diagnosing conditions like bladder pain syndrome, especially when inflammation is suspected. It's important to remember that while urine cytology is highly specific, meaning a positive result strongly suggests the presence of cancer, it is not perfect at catching every case. Its sensitivity varies, especially for low-grade tumors that may not shed many abnormal cells into the urine. Because of this, doctors usually use urine cytology alongside other tests such as imaging scans and cystoscopy to get a clearer picture. In summary, urine cytology is a non-invasive, valuable tool in the toolbox for managing bladder health and detecting bladder cancer. It helps identify abnormal cells in urine that could point to malignancy or other issues in the urinary tract. But it's not a standalone test. It works best when combined with other diagnostic procedures. If you have concerns about bladder health or symptoms, it's always best to consult a healthcare professional who can interpret these tests in the context of your overall health and guide you toward the most appropriate next steps.